Hi, and welcome everybody. I'm Lisa Fain, CEO of Center for Mentoring Excellence, and here in my capacity as a member of the board of the International Mentoring Association. We're continuing our series of interviews with experts in the mentoring arena, and I am so thrilled today to be speaking with Dr. Karin Polifko. I want to tell you a little bit about her before we dig into what I know is going to be a really rich conversation. So Dr. Polifko earned her PhD in Urban Health and Public Administration from Old Dominion University. She spanned both the academic and service areas of healthcare. So that really makes her experience unique. She can talk as a clinician. She can talk about academia, which is something we'll dive into. In her academic positions, she's held the role of director, dean, and vice president. She's held service positions of vice president of education and research and administrative director for critical care services. She has 3 amazing publications in the field of the nursing profession, concepts of nursing profession, the practice environment of nursing, and case applications in nursing leadership and management, as well as some really deep expertise in mentoring multicultural employees. So I'm really excited to talk to her about that. She's taught in undergraduate, graduate, and the doctoral levels, and has consulted with numerous healthcare institutions of higher ed with past projects that have included new college and program development, outcomes management, accreditation preparation, curriculum assessment, and revision. So Karin, I'm thrilled to welcome you here today. So glad you could be with us.
Well, thank you. It sounds like I've done a lot of work in the past.
It's always funny to listen to our own bios.
I know, so I go, wow.
Yeah. So maybe we can just dive right in can you talk a little bit about how you came to be interested in mentoring and where your interest in mentoring lies?
Sure. I think it actually started with my first management position. I was a young 25 when I had just graduated from University of Pennsylvania, and I was basically in charge of 3 intensive care units in Philadelphia. I knew nothing about management, and I thought I knew everything. Well, I very quickly learned that I couldn't do it on my own. So I sought out not only friends, but leaders, but others who I was trying to say, wait a minute, they have something they can teach me. And so I started learning at an early age that you can't do it all yourself, that you can't go on a path without asking for help. And so as I became more and more assured in my management and leadership roles, I turned that into, okay, what can I do for others? And so with that sense, every role that I take, I try and say, I can't do this by myself. And how can I bring others along that path with me? So I guess it started at an early age when I thought I knew it all and learned very quickly that I didn't.
Yeah, and found somebody and people who could help you increase that knowledge. That's incredible. So you have really, I want to talk to you a little bit about both the academic world and the workplace. But before we do that, you have a special interest in mentoring multicultural mentees. So can you talk about how you came to that interest and maybe just tell us a little bit about where your thinking is in that subject?
Sure. My dissertation work was actually on Asian work values. And I've always been intrigued with other cultures, their folkways, how they perceive the world. And so, after doing a deep dive for dissertation work, I always, had my radar out for those who I could learn from. And so that's where a lot of this work started. And coincidentally, I also have 2 daughters that I've adopted from China. So, understanding that not everybody looks through the same lens that you do, that really has expanded my span of information. And so, you can't, again, go it by yourself, but you also, just because we live in this particular area of the world doesn't mean that everybody does it our way. And so I always feel a responsibility to ask, to observe, and to see what I can do to be led by others in their area of expertise or in their area of specialty or even in their general culture.
Yeah, it's so interesting. I do a lot of work in this space too. And one of the things that I encounter, I'm wondering if you see the same thing, Karin, is people will either dance around cultural differences or ignore it altogether and think like, I don't need to even address it because it's a third rail. And so getting them comfortable with having these conversations can be a real challenge. How do you do that?
Well, I've taught many classes and I've done lectures on this, and I always start with, we all come to the table or we all walk into the room with prejudices. We all are biased. We all have stereotypes, but you have to acknowledge that. I mean, it's just human nature. You know, it's what you grew up with. I grew up in New Jersey. So fill in the blank. All Southerners are X, all Yankees are Y, you know, so you can, everybody, that's just human nature. You all come to the table and walk into the room with certain background pieces of history. And I think that first step of working with others of different cultures or mentoring others is to be cognizant of the fact that you do come with those intentions.
Yeah, for sure. For sure. What are your best tips for mentoring people from different cultures?
Listen and observe.
Yeah.
I mean, that's the first thing. Don't assume that everybody's the same. I know, like coming from, you know, I went undergrad to Carolina. So when you come from New Jersey to a Southern state, it's a whole different world. Likewise, I'm sure that people who come from Southern states who go to school up north say the same thing. Likewise out in California. So, you know, I don't know that we're all different, but yet we're all the same. And so I think at the end of the day, you know, it's a very comforting feeling to know that others are uncomfortable at different times. And it's up to you as the mentor to ensure that you acknowledge that. And so that's one of the first things I always try and do is say, you know, you may not be from here, or you may not have encountered this, or you may not have even worked in this environment. And because you also have not only intercultural mentoring, you also have workplace, you know, mentoring as well. So I think a lot of that is just self-awareness that extends outward to others.
Yeah. It always begins with self-awareness.
Yeah.
Right.
Always. And that's the hardest thing to do, though, Lisa. That's the hardest thing to do, is to say, listen, I may have an issue, but I've got to drop that barrier and I've got to be observant. You know, I've got to watch. I've got to see what the first move is. And so I think once you become self-aware, you don't assume that everybody does it your way. And I think that's important.
The second piece then is like understanding and acknowledging that some of these differences make a difference. It's not a better or worse thing, but having these cultural differences impacts your outlook, impacts your perspective, and acknowledging those differences and getting curious about them is as important too, right?
Well, and especially, you know, my career has spanned between healthcare and higher ed. And in healthcare, you have to be cognizant of cultural differences in order to effectively take care of your clients. You have to. There are certain cultures that there are gender concerns. You know, there are certain cultures that males don't take care of females, you know, and there are certain cultures that the mother is in charge of decision making or the father is in charge of them, you know. So you have to be aware that your viewpoint is not held by everybody. And I think that, the medical and nursing fields have done a very good job with saying, okay, here is transcultural, you know, healthcare, but likewise into the classroom as well. You know, just because you have a group of students who like to work together, that collectivist, you know, work ethic is not always held by every culture. You know, some cultures are much more individualistic, like, you know, the United States, we're very individualistic. And other cultures, such as some of the Asian cultures, are very collectivist. And so I think as an educator, you have to be also cognizant of, well, when you do work assignments, how are they going to be best met? You know, and so I can just go on for days on this, but I just think that it's an awareness, regardless of what field you're in, and those just happen to be my two fields, that you just have to be aware that not everybody does business as usual as you're used to.
Right. I love that. I love that. So that's a great segue into what I wanted to ask you about, which is this difference, if you will, of mentoring in the healthcare world versus the higher ed world. How do you see those approaches differently, and what's needed to do so successfully in each of the arenas?
Well, I think in the healthcare world, you have variables that you just cannot predict. If you are a manager of a particular unit, or if you're a manager over a particular outpatient area, you don't know who is walking through the door. So you have to be prepared for, a lot of different variables, a lot of different cultures, a lot of different people, ages, gender, the whole 9 yards. Whereas I think sometimes in higher ed, it's a little bit more controlled because you have a set group of students. Now, granted, you cannot always predict your student population. You cannot predict your faculty population, but they're not on a quick, revolving basis. Does that make sense?
Yeah.
Like if you go into a classroom, once you survey your classroom, you kind of get who everybody is and you're with them for a designated time frame. Whereas in a healthcare setting, whether it's an office or whether it's a hospital or whether it's an ER or, wherever it is, you just have this constant influx. And so you almost have to be on your toes on a constant basis. And depending on where you are, you may have different influences.
Mm-hmm.
Like if I'm in South Miami, I'm going to have a very different cultural influence than I would if I was in Kansas.
Sure.
So you just have to be aware of not only your strengths as a healthcare provider, but the the cultural influence around you and all the population influences around you.
And how does this influence the mentoring relationship?
Again, it starts with you. And, I always would say whenever I had male students in nursing or other fields, not every female is comfortable with that. Likewise,
Mm-hmm.
not every male, is comfortable with a male nurse, so there's just a lot of gender. You have to be cognizant of gender. You have to be cognizant of spacing. The United States, we have a certain space that we approve, personal space and social space. Other cultures, you're like right here. And that's normal. Whereas for those of us in the United States, it's not normal. Everybody has a different sense of privacy. There are some cultures that, hey, no big deal. Others remain clothed from head to toe and only, disturb a piece at a time. So I think that the important thing is, at least in the healthcare arena, is to really watch carefully and understand the culture in which your client is from. And also look at their community, who is with them. And I think that also that relationship is very important. There are some cultures that the male is the communicator and makes decisions and is present at all times. And there are other cultures it's not that way. So again, having an understanding, I think, is vital, just so that you offer the best care possible in a compassionate and empathetic fashion. You don't have to know all the details, but at the end of the day, I would always say, be curious. Ask within parameters, ask respectfully. You can always say tell me more, tell me about, what are your preferences? Every culture looks at birth, at illness, at death through a different prism.
I heard it
and you
referred
need to look at that.
Yeah, you do need to look at that. I heard it referred to recently as the fine art of noticing.
Yeah, I agree.
As it's not about judging, it's not about evaluating, but it really is the noticing of it and the getting curious about it is what's really, I think, can be so.
Well, and it's that curiosity, because it's not nosiness and it's not judgmental, but in order for me to either care for you, work with you the best that we can, and to have the most, the optimal relationship, tell me what's important to you. Mm-hmm. Tell me from where you come.
Yeah.
And that's that active listening.
Right.
And I think that's one of the things that I always emphasize when mentoring somebody. It's that active listening, and it's not the immediate reaction. It's let's observe, let's ask before you jump in with your assumptions and stereotypes and prejudices.
Yeah. And you're right. We all have them, right? It's really, beginning to surface those and address those that can be
Yes.
so critical.
And it's uncomfortable. And because again, depending on your cultural background, some are told, well, you're the best in the world, and others are inherently subordinate. Not on the totem pole. You look at some different caste systems. You look at different, I can, like I said, there's just so many different layers to culture that as the provider or the educator, you just have to cautiously observe and cautiously ask.
Do you have a favorite resource for people who are looking to learn more about becoming more culturally competent or more culturally aware?
Well, my dissertation was based upon Geert Hofstede, and he was an IBM data scientist years and years ago, and he developed several books called Culture's Consequences. That's very hard to say quickly. And what he did was he looked at various cultures throughout the world to see if they were individualistic, whether they were collective, whether they were masculine, whether they were feminine, a lot of the different characteristics. And I found it fascinating work, so much that I actually contributed to another population that he hadn't looked at, and that was the Filipino population. And so I think that if anybody's really interested in a non-healthcare, non-education focused way, Geert Hofstede really developed the whole idea of looking at work values and looking at culture's expectations on one another. So I just think that he has wonderful, wonderful resources. So Geert Hofstede. And then, of course, in nursing, you have Madeline Leninger, who has written a lot on transcultural nursing. So that's the nursing end of things.
Yeah, great. We'll track those resources down and we'll put them in the notes to this video.
Yeah, I'll provide some other ones for you too, but those are the two that are right off the top of my head. Great.
Yeah, I'm always looking for more. I mean, I'm looking to the side here because I have my own little cultural library as well.
Yeah.
Fantastic. Well, what one thing do you want to leave the people who are watching this video with when it comes to the work that you're passionate about?
I would say that the most important thing is ask, don't assume. And I think that you're not always able to blend in. However, come with your strengths, and listening, active listening is probably one of the most important factors that you can do. Ask somebody what's important to them. Ask somebody what's not important to them, because again, everybody has different levels of what you want somebody to know about you, and others may be much more private. So again, it's that active listening, it's observing, and also self-awareness.
Spectacular. Well, Dr. Karin Polifko, thank you for your time and your wisdom and your good work in the field of mentoring. I know I learned a lot from this. I'll be watching it again and taking notes. I appreciate your time and being with us today.
Thank you so much. I really had fun doing this. I can talk for days on this, so I'm glad that you cut it off right now.
Thanks so much.
Thank you.